Pain is a fundamental human experience, a signal our body sends when something is wrong. It can be a fleeting sting or a chronic, grinding presence that reshapes daily life. For millions, pain is not just a symptom, but a debilitating condition that dictates what they can do, where they can go, how they feel. It affects work-sleep relationships. In the quiet hours of the night, a persistent throb in the back, a sharp ache in a joint can feel like a prison. The search for relief is a deeply personal and often frustrating journey, leading people through a maze of medications, physical therapies, alternative treatments, each with its own set of promises and limitations. This search has created a vast landscape of solutions. A new method, which has been dubbed quantum reflex therapy, has emerged with a set of remarkable claims. The core idea rooted in reflexology combined with principles of quantum physics. Specific points on the hands and feet, known as reflex zones, connect to different parts of the body. By stimulating these zones, one can influence the body's internal systems. This is not a new concept. Various forms of reflexology have existed for centuries. What is presented as novel here is the mechanism of stimulation, which involves small, specialized chips that are applied to the skin. According to the creators of this method, these are not ordinary patches. They are described as quantum chips designed to interact with the body's bioenergetic field. The claim is that when one of these chips is placed on the correct reflex zone on the back of the hand or foot, it sends a unique signal to the brain. This signal is termed a quantum reset. The theory suggests that this signal prompts the brain to re-evaluate the pain signals it is receiving from an afflicted area, such as the neck, shoulder, lower back. In essence, the chip is said to trigger a natural self-healing mechanism, instructing the body to alleviate the pain on its own. The most striking claim associated with this therapy is the speed of its purported effect. Promotional material suggests that relief can occur in as little as 3 seconds. This near-instantaneous result is presented as a miracle of science, a way to bypass the slow and often incomplete relief offered by conventional treatments. The method is non-invasive, meaning it does not break the skin or require ingestion of any substance. This is a significant part of its appeal, as it avoids the risks associated with surgery or the side effects of medication. The idea is simple: stick a chip on your hand and your back pain disappears. It is a powerful and seductive narrative. It is important to understand that these descriptions are based on the claims made by the product's creators and promoters. They are presenting a specific theory of how their device works. The language used, quantum reset natural healing mechanism, is designed to sound scientific and advanced. However, presenting a theory is not the same as providing proof. The narrative is compelling, suggesting a harmonious interaction between ancient reflexology and futuristic physics. It paints a picture of a clean, elegant solution to a messy and persistent problem. But for this picture to become a reliable medical tool, it must be examined through the lens of scientific evidence. The gold standard for evaluating a new medical treatment is the randomized controlled trial, RCT. In an RCT, a large group of patients would be randomly assigned to receive either the real treatment, the quantum chip, or a placebo, a sham chip that looks identical but has no active component. Crucially, neither the patients nor the researchers administering the treatment would know who is receiving which version, a process known as double blinding. This design minimizes the powerful influence of the placebo effect, where a person's belief in a treatment can cause real physiological changes. The results would then be statistically analyzed and published in a peer-reviewed journal, open to scrutiny by other experts. Currently, publicly accessible, peer-reviewed studies of this specific quantum reset technology are not readily found. The absence of such evidence does not automatically mean the therapy is ineffective. It may be that the research is new, ongoing, or has not yet been published. However, it does mean that we cannot independently verify the claims being made. The use of terms like quantum can also be a red flag in consumer health products. While quantum mechanics is a legitimate and profound field of physics, its principles are often misappropriated in marketing to lend a veneer of scientific credibility to products whose mechanisms are not well understood or proven. The claim of a quantum reset signal to the brain requires a clear, testable biological explanation. Furthermore, safety, while less of a concern for a non-invasive device, cannot be assumed. The primary risk with an unproven therapy is not necessarily direct physical harm, but indirect harm. A person might choose to use this device instead of a proven medical treatment recommended by their doctor. Delaying effective care for a serious underlying condition could lead to worse outcomes. For anyone intrigued by the idea of a new pain solution like quantum reflex therapy, take a path of cautious curiosity. First, gather information from reliable sources. Look beyond the product's marketing materials. Seek out info from independent health organizations. Seek out info from university medical centers. Seek out info from government health agencies. These institutions give balanced reviews of emerging health trends. They help you understand the state of the science. Be healthily skeptical of claims that sound too good to be true. Ask critical questions. Where are the clinical trials? Who funded them? Have independent researchers replicated the results? Next, consult a professional. Talk with your primary care physician. Talk with a physical therapist. Talk with a pain management specialist. They know your health history and prior treatments. They can assess whether an unproven therapy might help, or whether it adds risk to your treatment plan. Be completely open with your doctor about what you're considering. Withholding information can be dangerous and prevents proper monitoring. If you decide to try the device after research and consultation, proceed with caution. Use it exactly as the manufacturer directs. Try it for a limited trial period. Watch your body's response closely. Keep a simple journal of pain levels, side effects, and other changes. That record helps you and your doctor decide if it's working. Do not make abrupt changes to your medically approved treatments. Do not stop prescribed medication or cease therapy without your provider's guidance. Finally, manage your expectations. A 3-second cure is alluring, but pain management is often slow and steady. No single product is likely a magic bullet. Lasting relief often comes from a comprehensive approach: medication, exercise, dietary changes, stress management. Treat a new device as one component of a broader strategy, not a miracle cure. This lets you explore possibilities without abandoning proven care. In conclusion, the challenge of managing pain is one of medicine's most persistent problems, and the desire for better solutions is urgent and universal. New ideas like quantum reflex therapy emerge from that need, offering compelling narratives and claims of rapid, science-based relief. The proposed mechanism uses specialized chips on reflex zones to send a quantum reset signal to the brain, an intriguing concept that blends ancient practices with modern terminology. It imagines a future where pain can be controlled without invasive procedures or the risks of powerful drugs. That hope fuels innovation and deserves serious attention. But hope must be tempered with rigorous evidence. Currently, claims are supported mainly by anecdote and promotional material, not by robust, peer-reviewed science. Independent validation of near-instant effects or the quantum reset is still lacking. Without that, the therapy remains unproven. The path to trusted medical use is long. Meticulous research-controlled clinical trials and transparent reporting of results. For people with chronic pain, navigating unproven options is hard. The wisest course is informed caution. Practice critical thinking, do thorough research using unbiased sources, and most importantly, have open dialogue with trusted healthcare professionals. A doctor can weigh unproven potential against the risks of delaying established treatment. Stay open to possibilities, but grounded in evidence-based medicine. Safety must be paramount. The quest for better pain management continues. Advances in neuroscience materials, science, and the body's own healing capacities may bring real breakthroughs. Therapies like quantum reflex therapy could one day join the toolkit, once efficacy and safety are proven. Until then, treat such claims as questions that invite scientific investigation, and remember the journey toward less pain requires both hope and wisdom.